Welcome to the Medical Marijuana and Wellness webinar series. Today's topic is understanding and optimizing sleep. My guest is Dr. Greg Holt. Dr. Holt, tell us a little bit about yourself.
Hello, everyone. Got a PhD in physiology from University of Florida College of Medicine. I'm a board-certified clinical sleep specialist with American Academy of Sleep Medicine. And currently I work with ALS patients, mechanical ventilation in Texas, and I'm the president of the Texas Society of Sleep Professionals.
So it's safe to say you have a little experience with sleep.
Yes, I do.
That's great. I want to point out to everybody that this presentation is for informational purposes. And naturally, if you're looking for medical advice, please seek out advice from your physician and your medical marijuana doctor. Greg, let's talk sleep for a second. Why do we sleep? I know one of the reasons is to survive, right?
Oh, absolutely. There's something called fatal familial insomnia, where you can live for about 3 months or so without sleeping at all before you die. Rare kind of condition, but we sleep to stay alive and to stay healthy. We regenerate the brain. You know, all the cells start to replenish themselves when we're in slow wave sleep. So you get quality of sleep, refreshing sleep in the first third of the night. And then during the day, you're able to function when all of the cells are reset and ready to go.
That's very interesting. Also, it keeps our nervous system functioning.
A lot of important things are going on, you know, when the cells are starting to like send out all kinds of like neurotransmitters when you're in a wake state, because there's a lot of things going on, movements going on, speaking, anything that's happening during the day, it takes more activity. So it's a chance to regenerate itself. So that's what
it really helps you. Important. It reconnects all those neurological connections and helps you, in essence, reboot your body. I think the other is also to help us grow and heal.
Yes, it does. When you talk about growth hormone being released during that slow wave sleep, especially in children and infants, who gets the most slow wave sleep? It's the younger you are. The pediatric patients and the babies, they get the most slow wave sleep, and they are sponges for knowledge.
That's really interesting. Now, sleep is a pretty dynamic state. In other words, there's not just a sleep, there's a couple phases that we go through.
Yeah, you can't just say somebody's asleep because they got their eyes closed. Of course, you know, you don't know if they're conscious and they're able to interact with their surroundings if their eyes are closed. So sleep shows up by EEG when you're looking in the brain waves, and you can't fake it. But there is a lot of things going on. You move through different stages of sleep, and when it says pain can affect your sleep, you can see pain on an EEG.
That's interesting, because pain and anxiety are the main reasons why people are having trouble sleeping. So when you define sleep, from your perspective, you define sleep for me, because I know people talk about REM sleep and that type of thing.
Yeah, well, you know, the easiest way to say what is sleep, it's like the opposite of the conscious wake state. So when you say that you have there's a difference too between wake, sleep, and unconscious. Loss of consciousness is pathologic. You know, it's not the same as sleep where you're arousable. It's a very different kind of a thing. But when you combine EEG waveforms with a body, sort of like the body's state of habit, what they're into while they are sleeping, you can kind of get the idea. But you have to combine several things together to say that they are truly asleep.
Yeah. And it's really important, as you were mentioning earlier, it's really important that you sleep. I know insomnia is suffered by a lot of people. They say 64 million people in the United States have insomnia, and actually women are more sensitive to it as well. But tell me about treating insomnia.
Well, it is like the most common sleep disorder when you're looking at it. So you try to find out if it's an acute form of insomnia or a chronic form of insomnia, depending on how long it's lasted. And then you look for the underlying factors, and I'm glad the way it shows up like this in the slide. It's trying to say that find out what could be causing the insomnia, because like the previous slide, it said pain. Sometimes if you relieve the chronic pain by almost anything, whatever kind of medication, or like actually treating the site that's causing the pain, then sleep improves just by removing that cause. So if there's insomnia caused by a psychological issue, like you're ruminating or obsessing over something, sometimes there's some things that you can do to sort of relieve that type of anxiety that could cause like a chronic form of insomnia. So different ways of doing different things. That CBT is cognitive behavioral therapy. There
Mhm.
are like, dozens of things that you could try. You can look up under sleep hygiene to sort of relieve that kind of insomnia that may be happening. But one big thing is that if you have an acute form of insomnia, it lasts like a day, 2, 3 days. You just can't worry about it so much, and then just recognize that once you get back into a normal sleep wake cycling again, all of that will probably go away. But you have to work on the underlying cause if it is some other factor that's causing that insomnia.
And that's really important to point out. When you identify that, it really helps you get better sleep. Really, and sleep duration and quality is directly related to your health. And over here's some recommended sleep times based on your age.
It's a tough thing was we've moved into more video games, social interaction, social media, that younger and younger people are becoming more involved online, and that's taking away from what they really need. When you talk about a 13-year-old need 10 or 11 hours of sleep, I would say more than half of them aren't getting that anymore. It used to be into the high school age with social interaction that, they start like cutting back on the amount of sleep that they truly need. But you
Mhm.
can see even when you're in the college age years, when you're looking at 7 to 9 hours, there are too many people that sort of cut themselves short with the amount of sleep they need. And
Right.
that's really not right at all.
I think we don't really pay attention. I know when I was younger, I didn't really understand the importance of sleep. Although I could feel it, I really didn't understand it as well as this chart points out. Tell me about your immune system because your neurons control your sleep. That has a lot to do with your being able to sleep well and being able to control or be able to manage some of your sleep disorders.
Yeah, there's a lot of like neural sites inside the brain that are responsible for the wake state, like part of the frontal cortex is more involved with wake state. It's like being on a seesaw. If you've got your hand on the heavy part pushing the seesaw down one way, you'll be awake. As those factors are removed, then you'll be more inclined to fall asleep and be asleep. So if you think of that seesaw kind of mechanism for a wake state, sleep state, we look at what area of the brain is pushing on that seesaw to
Mhm.
force you to be awake or can force you to be asleep. Some
Mhm.
pathologies like narcolepsy will just trigger you into a sleep state that actually has a conscious component to it, like almost immediately, with surprise or something like that that can make
Sure.
somebody seemingly fall asleep. But when you look at the rest of this slide, you see some things. Cytokines are like cell active substances that are just released, wake state and sleep state, that are important for the immune system. So to keep everything functioning properly, sleep is incredibly important.
Right. And again, there's a number of disorders that can really affect your sleep, and that's really important to pay attention to. And to really, half of solving a problem is admitting that you have it. And when you see that you have that problem, getting some help is really, really important. Also, you mentioned that in normal sleep, you went over this slide with me when we were practicing. This is very fascinating how this all works.
This is the most important slide if you consider sleep. If you're looking at, what am I doing? What am I doing right? What am I doing wrong? If you understand this slide when you're looking at it, C would be the circadian rhythm. And it's not just a nebulous thing. The circadian rhythm is the brain making proteins and breaking them down to set this circadian phase. When you're on the down slope of that circadian phase, you're more likely to be asleep. But
Mhm.
that S is the sleep pressure. So sleep pressure has to build up through the day, and you have to be on the down slope of the circadian phase to fall asleep naturally. That's
Mhm.
the whole idea. If you take a nap, you relieve that pressure to fall asleep. Or if the circadian phase is off, which is set by sunlight primarily, let's say
Mhm.
that you're in a room that's just lit with like just overhead lighting. If
Mhm.
you're in like a dimly lit room all day, you're going to have a flat affect, and you'll have what's called SAD or seasonal affective disorder, like some of the people north of the Arctic Circle. But you
Mhm.
have to have that circadian phase cycling, and you have to have sleep pressure built up to fall asleep naturally. Anything that gets screwed up on either one of those, some of the common problems with circadian phase is advanced sleep phase syndrome, sort of like farmers, and delayed sleep phase syndrome, like college age students that go to sleep late, very late, and farmers that go to sleep very early. So
Yeah.
it's those are some things that you have to really match up. And once you understand it, you're better able to like fall asleep naturally when you understand what you did with your system that day or over time. So
Right.
matching them up is critical.
And you can feel whether you've slept well or not. It's in there. Now, there's a lot of talk about REM sleep. What is it?
REM sleep, or rapid eye movement sleep, you're with your eyelids closed, your eyes can can jerk in phasic eye movements up and down, left and right. And so when you're looking at rapid eye movement sleep, it doesn't happen the entire time you're in REM sleep, but it's a cycle of sleep where most dreaming takes place. So they figured that out by watching people going into REM sleep by EEG. They tried to wake them up and ask them if they remember their dreams. That's how they were like figuring out. You can dream in almost any state of sleep, but in REM sleep, most of it happens, but you're paralyzed. Everyone is normally paralyzed when they're in REM sleep, so you don't flail around and act out your dreams. Now, one of the most interesting parasomnias is this REM behavior disorder, when you're in REM sleep, but you regain motor control, which can be terribly dangerous. It can't be faked, but if you see muscle movement during REM sleep, it's dangerous because you can fall out of bed thinking you're diving out of a boat. A lot of other bad things can happen with REM behavior disorder.
It's interesting. Now, you also mentioned that over here, that there's a lot of studies that shows that it really affects the development of your mental skills, right?
And it's important for psychological health. So doing anything that can reduce REM sleep cycles every hour and a half after you fall asleep generally. So it starts off very short with a short period of REM, and then every next hour and a half, 2 hours later, it's a longer period. So you have most REM sleep in the last third of the night. That's when people remember most dreams. That's because it's their longest REM period. So, but it is something, I think it's one of the more interesting phases of sleep.
Right. And here's some of the stages. Now, you were explaining this to me. It's interesting to see all these little blips that are in here. They have some significant meanings.
So, right eye, left eye, or right outer canthus, left outer canthus, they're looking at eyeball movement. It's not a muscle movement, but you can see that big waveform in those two things where those are the phasic clicks of eye movements right there. So underneath your eyelids, when your eyes move in that phasic kind of pattern, it can pick it up. And that's how we calibrate it before you fall asleep in a sleep lab, is we get you to look left, look right, look up, look down. And then we record and put down on paper which way you are moving your eyeballs. And that way we can pick up like the phasic eye movements during the night. Now, see that E and G electromyogram, that's a muscle signal below that. You see how it's really dense on the left side and it becomes less dense on the right side. And that means you're losing muscle tone. That's that paralysis that starts with REM state. So you don't move, that flaccid paralysis. And below that, when you're looking at brainwave activity, what's underlined are these really quick sawtooth-like movements of EEG pattern that also cannot be faked in REM sleep. And that just shows that you're in like by brainwave pattern, you're in a REM state.
Interesting. It's very interesting. So it's easy for you to actually track this.
Oh yeah, you can just see it jumping out at you. Absolutely.
Now, there's also non-REM sleep. You mentioned that every 90 minutes you fall into REM sleep. There's a lot of times you're not sleeping or not in REM sleep.
And that's why they separated it out, because if you got REM, non-REM, and wake state is what we put into a sleep histogram, or an all-night sort of tracing of what sleep stages you move through.
Right.
Non-REM sleep, when you go through N1, N2, N3 sleep, that's a new designation, relatively new. The old designation was stage 1, 2, 3, and 4 sleep.
Right.
N3 sleep is the deepest stage of sleep, first third of the night. N1, N2, N1 is the lightest stage of sleep where you're easily aroused. And N2 sleep is sort of like an intermediate stage of sleep, but it's got some interesting waveforms about that one as well.
Right. Interesting. Yeah, because what's interesting is you were mentioning the way you look at this is you're measuring the electrical bursts that are going on within your body.
Yeah, EEG for electroencephalogram means populations of neurons around the cortical surface of the brain, the outside surface of the brain, how they discharge as a group. So they're picked up by those little metal cup EEG electrodes that are pasted all around the surface of your skin, and you can pick up things like PGO waves. I tell you, you really won't see many PGO waves on a real sleep recording. I mean, they're there. They say they happen a lot here in the slide here, and people that write about them say that they happen a lot, but they really don't. I mean, I've seen thousands of EEGs, and I didn't see a lot of PGO waves whenever I'm looking at it. So, but they are there. There's something that you need to know about, but just one of the interesting kind of things that you see on EEG.
Sure. So here's the different stages. I mean, we talked about stages of sleep before. There's 5 stages of sleep that really people go through in the evenings or during the day when you are sleeping.
Oh yeah, you don't have to move through each one of those in a row, but generally, N1 sleep is the first thing when you transition from awake state to sleep state. So you move from that sleepy state when your brainwave transfer, like the old, when you try to meditate, you put yourself in an alpha state. Alpha state is just a relaxed state of mind and you're not thinking about anything. If you do math in your head with the EEG on, you're not in an alpha state. You can see that on EEG. But if you're relaxed in an alpha state, which is a 10 cycle per second waveform, and then you can see what's called slow rolling eye movements. That is a wake state about to transition into sleep, and it's generally N1 sleep that you see. It's interesting, but if you have too much N1 sleep on a sleep recording, it means that you're not getting the right kind of sleep. People in chronic pain have a lot of N1 sleep.
That's interesting. So you actually monitor a lot of this when you're looking at patients and helping them figure out how to sleep better.
All night long, I look at everything, and try to help them out what I see on their EEG overnight to tell them where they are and what they might be able to do to help themselves out. Because when you look at N2 sleep, well, here's a good slide at N3 sleep. N2 sleep, like I said, was intermediate. But N3 sleep, where you see those really tall waves on the bottom tracing. The bottom tracing tall waves are bleeding through into the eye channels, but on the bottom channel, those very tall amplitude waves are slow waves, and that's the brain cells, the neurons, resetting themselves by not firing so fast as a population of cells. So you have these slowly discharging high amplitude cells with everything resetting themselves. So in N3, which is old stage 3, stage 4 sleep, stage 4 just has a higher density of that high amplitude slow waves, delta waves. But you can see all that, and that's when you're really in deep sleep, hard to arouse. Some people, when they're shaken awake from deep sleep, can be aroused into a combative state where they could wake up, not know where they are, might even wake up swinging because they're afraid, and can't even speak for a few seconds because they're the cobwebs have not cleared. So N3 in the first stages, first third of the night, difficult to arouse, but it's the deepest form of sleep, restorative sleep. Very important.
That's really where you're headed. That's really where you want to be.
Exactly. Need to get deep sleep. And who gets the least amount of deep sleep? Older people.
That's interesting. Now, there's a whole concept of what they call circadian rhythms. This is interesting. Why do we sleep when we sleep? Run us through this, because our clock is really more 25 hours than 24 hours. Is that correct?
When you're talking about a free running rhythm, and these are like a bunch of guys that spent some time in a cave, no clocks. They didn't have any set sleep-wake cycling, and they found out that the body's normal phasing was longer than 24 hours. Same thing with blind people. They have a longer running circadian phase or circadian rhythm. It's not timed with sunlight, obviously, but it's timed more with social interaction. So those are the kind of guys that need clocks to sort of guide them through their course of the day to keep their circadian rhythms functioning the right way. But remember when I said circadian rhythms was like the brain making proteins and breaking them down. So you've got genes inside these neurons of that suprachiasmatic nucleus that sort of set the wake sleep cycling. These genes, like timeless gene, period gene, several other genes like that, will make proteins that signal sleep state. And you can have melatonin released during the night. That's why people believe if it's an endogenous kind of substance or inside the body like melatonin, and that should help with like a sleep onset. So they started selling melatonin over the counter to help with that circadian phasing. But if you get sunlight in the first half hour during the morning, about the same within the first hour or so, the same time every day, you'll help shut off melatonin, improve your wake cycling up. And that helps set the circadian phase by shutting down some of those proteins that are being made. So all of these things are important: biological clocks, circadian rhythms, the suprachiasmatic nucleus. And what feeds into the SCN? It's like optic input, so your eyes with light, and then social interactions like being around the, just sort of the coffee pot in the morning, talking to people, that kind of thing can also set the circadian phase to be cycling up.
And all these, it's really important that they all essentially kind of get in phase together.
That's the importance of like having bright sunlight, indirect, it's not staring at the sun, but it's being in a room with breakfast, with bright indirect sunlight coming into the room. That's the important part. Going like with dark sunglasses on to a dimly lit office is not it. You're going to have these depressive kind of symptoms, and you might get treated that way, which is wrong when all you needed was a little bit of Mother Nature.
Yeah, kind of interesting to point out. Now, in order to sleep better, you introduced me to something called the Epworth scale.
Yeah, the Epworth sleepiness scale. It's important because, sleepiness is sort of like pain. It's like how much pain are you in, 0 to 10, 7 being that's pretty painful. Same thing with sleepiness. You can't really put an objective number or measure on it. So this makes an attempt, and it's good for what we got, but you can see that it's got some issues. If you ask people to take this test, it was like sitting inactive in a public place. It's like, well, I never go out, so I put a 0. Well, that could falsely reduce that number of how sleepy you are. So we take a look at this and we try to make sense out of it. The biggest thing is that if you're up over like 10 on the sleepiness scale, if you're around 14, then I think you got some issues. If you said that you dozed off at a red light or ever driven off the road to sleep, you've got big time issues. And those are the people that we see in the sleep clinic faster than everybody else.
Yeah. And there's a way of measuring this, which is interesting. In this YouTube video, look at the link below. You'll see a link in there to this actual sleep, to this chart. You can actually download it. The bottom line when it comes to sleep is a number of different things. I think the duration and quality is directly related to your health.
Yeah, getting the right amount. And keep in mind, when I say the right amount of sleep, it's like when they say that adults should get 8 hours, well, they looked at it and they saw that if you got less than 4 hours a night, or you slept more than 12 hours a night, those groups were dying faster than the guys at 8 hours a night. And they go, okay, those are our cutoffs. Right. We would suggest that you guys get 8 hours of sleep to sort of hedge your bets. But for whatever reason, that less than 4 hours or more than 12, they were dying faster than the guys at 8. So that's where they came up with the numbers, right. And the younger you are, the more sleep you need to have. And for very small kids, that's a thing called limit setting disorder. It's a parent problem that they can't make their kids go to sleep. And I've got 5 kids. And sometimes you got to lean on them pretty heavy to get in bed, work with them, but, get them all settled. And they're up, down, and then finally you have to put your foot down. But you can't let them get 6 hours of sleep and expect them to function normally and to be academic successes, because they won't be. They've done studies on that too for reduced sleep in pediatric population. You're really going to set them up for disaster academically.
And there really is no substitute for sleep. You want to improve sleep, it's better to done it through behavioral modification than meds. Is that correct?
Absolutely. In my mind, in sleep practice, that you want to fall asleep naturally, and you don't want to rely on medicine to put you to sleep every night. So when you take a look at that circadian and sleep pressure kind of graph, if you took 2 hours of a nap during the day, you're not going to go to bed and fall asleep at the same time that night. If you're aware of that, then wait and delay your bedtime by an hour or 2 hours, because it's not going to happen. You have to let that sleep pressure catch up with yourself. So sleep hygiene can be looked up anywhere on the net, on internet, on doing things right. Wake up at the same time every day within an hour or 2 hours. Don't try to catch up on sleep during the weekends because you're doing it wrong. Just recognize what you're doing and try to improve it. You might have acute insomnia, but it won't turn into a chronic insomnia problem if first you modify what you're doing. If you have a physiologic problem, pathologic problem, you have to fix that before you can think that insomnia is going to get better or sleep problems will get better.
Yeah, I don't know. When we were preparing this, you made an interesting comment about medical marijuana versus other alternatives for improving sleep.
Yeah, to me, on a acute insomnia kind of basis, if you try to adjust your sleep, remember, you fall asleep naturally with the right amount of sleep pressure and the downslope of the circadian rhythm. But medical marijuana can push you over that edge to fall asleep fairly well to get you to sleep. And to me, it's safer than a lot of the other drugs like Ambien that you can't just get out of your system. That's also got a psychologically addictive profile. Things like benzodiazepines, Valium, which they are good at different doses, they could be hypnotic, but the chronic form of those, if you keep taking them, we can see it on EEG. It shows up as this fast sleep spindling during the night, but also, it's got this physical addiction profile that you can't just stop it. If you've been taking it for months and months and months, you can end up having seizures. Right. So you're going to be careful with the kind of medications you take. And I think medical marijuana, truly believe that it is a lot safer than a lot of medicines that have been used over the decades. Barbiturates, bad news. Opiates, alcohol, even Benadryl, okay, every now and then will put you to sleep, but you can end up with a hangover effect, and it could be bad on your liver in the long run.
Interesting. Now, medical marijuana is safe, and according to the CDC, there's been no reported overdoses of deaths, both from medical as well as recreational marijuana. So it's something that is an alternative. I might point out to everybody that we have done a video called Improving Sleep with Medical Marijuana. It's available in this YouTube channel. Go to YouTube, marijuanaaware.com, to be able to see that particular video. Dr. Holt and I put that together. So Greg, any last thoughts?
One last thing about medical marijuana or marijuana in general for everybody that's a recreational user is that marijuana, the molecule resembles tricyclic amines, the antidepressants like protriptyline that suppress REM sleep. So if you suppress REM sleep that you need for psychological health, you are doing yourself a disservice. If you stop smoking marijuana, if you've been a chronic user for many, many months and years, every day, if you stop using it, you'll notice something called REM rebound, where you enter a lot of dream state for about 3 days. And then you know that you've been overdoing it.
Yeah. So, and also, I think, as we'll point out in that video on improving sleep with medical marijuana, the type of terpenes and the route of administration makes a huge difference.
Yeah, I think individualizing the dosage and the CBD content, THC content of everything for sleep. Find out what works best for your body. I know Marc is a big believer in that, in individualized kind of dosing and prescription for medical marijuana. It's a fabulous way to look at it.
Great. Well, listen, I'd like to thank everybody for joining us for this particular video. If you want to learn more about medical marijuana, please join us on our social media channels on both YouTube as well as Facebook. And also tune in on to our medical marijuana and wellness webinar series, marijuanaaware.com, to see what programs we're putting together, our schedule and timing. Thank you very much for everyone for joining us, and sleep well.